If you started looking into dental implants in Turkey, you've probably seen prices that sound almost too good. A single implant for a few €100, a full set of teeth for the price of one implant back home. The number that gets quoted online is real, but it's only half the story. The question that actually matters isn't how cheap is it? It's what does the price include and what's going to land on top of it once I'm there. That's what this video is about. We'll walk through what dental implants really cost in Turkey, exactly what's inside an all-inclusive package, and the cost people don't see coming until they already booked. Implant in Turkey costs roughly 350 to 900 euros, and full arch solutions like All-on-4 run between 3,500 and 6,500 euros per jaw. If you're replacing a full set of teeth, top and bottom, you're looking at somewhere around 7,000 to 12,000 euros in total. Now, that's the wide range, and the reason is simple. The price moves with the implant brand, the condition of your jaw, and how much work needs to happen before the implant even goes in. We'll get into why personal numbers might land high or low in a moment. The part that draws most people in is the comparison. The same treatment with the same implant system costs around 2,000 to 3,000 euros per implant in the UK and $3,000 to $5,000 in US. Across Western Europe, it's similar. So for some paying privately, Turkey works out 50 to 70% cheaper, and that's after you factored in the flight and the hotel. A proper all-inclusive package covers the entire treatment from the first scan to the final tooth, not just the implant itself. That's the whole point of the package model. One price, no surprise line items. On the clinical side, that means your first examination, your imaging, either a panoramic X-ray or a 3D CBTC scan, and a full treatment plan before anyone picks up an instrument. Then the surgery itself, the anesthesia, the implant placement, and the healing caps or abutments where they're needed. After healing, you'll get the final restoration, the crown, the bridge, or the full arch, including all the lab work and try-ins, and the bite adjustments. And reputable clinics back the implant system and the prosthetic with a written warranty, usually somewhere between 5 to 10 years, as long as you follow the aftercare. Then there is the travel side, which matters a lot when you're coming from abroad. Most packages include airport pickup, your hotel for several nights, transfer between the hotel and the clinic, and an English-speaking coordinator who manages your schedule. At Vera Smile, that coordination piece is built in specifically so international patients aren't trying to organize a medical trip in a city they've never been to. For full arch cases like All-on-4, there's one more thing worth knowing. You don't leave toothless. A fixed temporary bridge goes in within 24 to 72 hours of surgery, so you walk out with working teeth while the implant heals underneath. Here's the half nobody puts in the headline price. Even a genuinely all-inclusive package leaves a few things out, and knowing them upfront is the difference between a clean budget and a big surprise. Your flights are almost never included. That sounds obvious, but the cost swings a lot depending on where you're flying from and when you book. Peak season and last-minute flights can add a few €100 on their own. A possible second trip. Most cases are designed around a single visit, but healing isn't identical for everyone. If you need a bone graft or the soft tissue needs more time, the final prosthesis might mean coming back, which means another 2 flight tickets. 3. Major revisions. Routine post-op checks and small bite adjustments are part of the deal. A full prosthetic remake months later because something changed usually isn't. That's extra lab work and extra time. And the fourth is aftercare products. This is the quiet one. Your dentist will likely recommend a night guard, an implant-safe toothbrush, interdental brushes, a water flosser, and antimicrobial rinse. None of this is expensive on its own, but it adds up, and it protects an investment you just made. So it's worth budgeting for rather than ignoring. And one more, because people ask, insurance. We'll come back to that later, but the short version is you should plan to pay for this out of pocket. No, the price gap comes from how clinics operate, not from cheaper implants. This is the single most important thing to understand before you book anything. The implants themselves are made by the same global manufacturers that supplies clinic in London, Berlin, and New York. A titanium fixture or zirconia block doesn't get a Turkey discount. Manufacturers hold their prices tightly worldwide. So the raw material costs within about 10 to 15% no matter where it's placed. What actually differs is everything around the implant: rent, salaries, lab fees, insurance. Running a clinic in Turkey costs roughly 40 to 60% less than in the UK or the US. On top of that, clinics here that focus on implants do a high volume of them, which makes the whole process more efficient. And instead of billing you separately for the scan, the surgery, the abutment, the crown, and every follow-up, the way many Western clinics do, it's bundled into one transparent price. Same materials, same protocols, lower overhead. So the honest red flag isn't a low price, it's the lack of transparency. A reasonable price the clinic can explain is fine. A price that won't tell you what's inside, it is the one to worry about. Because the first number you get is based on an ideal case, and most mouths aren't textbook perfect. Once a dentist actually looks at your scans, they can see things a website never could. The big one is bone. If you've been missing teeth for a while, the jawbone underneath shrinks, and an implant needs solid bone to anchor into. If there isn't enough, you'll need a bone graft or a sinus lift first. Extra materials, extra surgical time, sometimes extra healing. The other common one is gum health. If there is inflammation or gum disease, that has to be treated before an implant goes in safely, and that's priced separately because it's a different problem. This is why two people who both ask for 4 implants can walk away with completely different codes. Bone density, gum condition, bite force, old dental work, it all fits into the plan. And ethical clinic confirms your price after looking at imaging, not before. If someone gives you a firm, final number sight unseen, that's usually a setup for upselling later. That's also why a free consultation where you share your scans first is genuinely useful. You get a real number instead of a hopeful one. Yes, the brand is one of the clearest things that move the price, and it's worth knowing why before you assume more expensive means better for you. Premium systems like Straumann, Nobel Biocare sit on the top. You're paying for decades of clinical research, refined surface technology, and very predictable long-term integration. Mid-range systems like Neodent, which actually is part of Straumann Group, and Hyosan cost less and still have solid clinical data behind them. They're reliable choices in the right cases. But here's the nuance that matters. A more expensive implant doesn't automatically give you a better result. A premium implant placed into a poorly planned case can actually carry more risk than a mid-range implant placed correctly. What determines whether an implant lasts in the diagnosis, the positioning, and the aftercare, not the sticker on the box. A good clinic recommends a brand based on your bone and your bite, and can tell you why rather than just steering you toward the priciest option. Most of the time, no. Implants aren't covered by insurance because they're classified as elective restorative treatment rather than emergency care. Private and international plans rarely reimburse implant work done abroad, so the realistic assumption is that you're paying privately. On the payment side, there is more flexibility than people expect. Clinics typically take cash or card, and many let you split the cost across the treatment stages rather than paying everything upfront, usually in euros, pounds, or dollars to keep it simple. Long-term financing over months or years isn't really a thing here. The installments are short and tied to the treatment itself. One thing to plan for: a deposit, usually 10 to 30% to lock in your surgery date and start ordering your materials and lab work. That deposit comes off your final balance. Just ask about the refund policy in writing before you pay it. Once the lab work and planning have started, deposits are often non-refundable, simply because those costs are already spent. So, is it worth it? For the right patient, genuinely yes. If you're paying privately, you need multiple implants or a full arch, and you're comfortable getting treatment abroad within a clear plan, the savings are real, and the clinical standards are there. It's less ideal if you need constant in-person follow-up, close to home, or you're expecting insurance to step in. The smartest move isn't chasing the lower number you can find. It's getting a real code based on your actual scans with every inclusion spelled out. At Vera Smile, the consultation is free. You can send your photos or X-rays, get an honest treatment plan with the implant brand and the full cost laid out, and decide from there with no pressure. If this cleared things up, subscribe. We break down the real numbers behind dental treatment in Turkey so you can plan with your eyes open. And drop your questions in the comments. We read them.